Hello, welcome to the YouTube page for the Pan-TEMS Pediatric Network Wellbeing, or is it Wellness? I'm pretty sure it's Wellbeing Hub. Either way, it's a mouthful. My name is Robin Barker. Thanks for joining this live webinar. I'm going to give you more details around how that's going to work in a second, but hopefully you have all been able to log on either in person, live, or after the date. So if I say anything dated or any of the jokes fall really flat, there aren't any jokes. But if they do, and if there are, it's only because you're watching this on a delay. And at the time, it was hilarious, and it was also really good content. So if any of those things aren't the same in the replay, then you should have tuned in live to listen to it. So we're going to be talking today about the elephant in the room. How do you lead on children and young people's mental health when you're not a mental health specialist? My name is Robin Barker. You can see me, I'm in the top corner. I'm a mental health nurse. I have only ever worked with children and young people throughout my career. Before I was a mental health nurse, I worked in youth services, and most of my career in CAMHS, in child and adolescent mental health services, I have spent working either in the community or on liaison working in acute hospital settings. Alongside working clinically, I made the sort of step into also working in policy. So I spent some time working at NHS England doing national policy and strategy, and also a number of years at Health Education England, again doing kind of national education programs, and learned a lot there. Really interesting, really aware of challenges to the system and what's going on, and we'll definitely tackle those in this talk. So now I'm free of all those roles, and I lead the We Can Talk project. The We Can Talk project works to try and improve the experience of young people when they come into hospital settings, so acute physical health hospital settings around their mental health. Tries to improve that really for young people and for the staff themselves who are supporting those young people. I'm not going to talk a lot about the We Can Talk project. You can find out lots more information about it on our website, so please check that out. We've got lots of top tips for having awkward conversations, which is I'm a big fan of awkward and direct and difficult conversations, which will probably become apparent throughout this webinar. We've got a really big social media presence as well, so please find out about all the stuff we're doing on our Twitter, on our Facebook, or if you are a hospital and you're thinking, oh, we need some more training or would like to do some work in this area, please send us an email. We'd love to chat. We work with over 50 hospitals across England at the moment, and the movement is growing, so that's great. And I'm really delighted today, off the back of that, to be asked to come and speak with all of you, especially because we've recently launched some new free online training, because obviously everything is online at the moment. And so I'll share more details about that at the end of the webinar. So also at the end of the webinar is what's going to probably be one of my favorite things. This is the awkward question Q&A. Okay, this is because I have been to a lot of Q&As recently where all the questions were so nice that it left everybody, me included, really bored. So please, if you've got questions around this topic, whether it's around questions around children and young people's mental health system in general, around how you lead through that, specific issues that I might not have gone into depth in during my talk, please ask them, tweet them to me at Robin from CAMHS, comment in the YouTube live below, and we've got a very technical system where someone's going to ping those over to me. If you're watching this on delay, don't put them into the YouTube live comments, because that's going to be like a dark hole that we kind of never go down again. But you can tweet me. I'm always interested to hear from people around this issue, because it's one of the ones that I'm really passionate about. So please do that. I guess just to say that the more awkward, controversial, tricky, difficult your questions are, the more likely they are going to be answered. Okay, and we've already had a few particularly awkward questions that I've put in at the end that we've had submitted in advance of this webinar. So but if you've got more, we'll take those as well. So please do that. So how to lead on children and people's mental health when you're not a mental health specialist. I love this topic. I appreciate being asked to talk about it. I'd like to acknowledge a couple of things first, though, and these are things that are really important to me, and just I see them as the basics for having any level of conversation around children and young people's mental health, especially speaking to staff that might not work within the child and adolescent mental health specialist system. So these things I want to acknowledge, first of all, is that every child and young person has got emotional and mental health needs. Health staff see more children and young people often in a morning shift than most specialist clinicians like myself will see in a year. That is a huge amount of expertise that you already have around this topic, because every child and young person has got emotional and mental health needs. So if you didn't feel that you knew a lot about this already, trust me, you really do, because you've been dealing with it throughout your entire careers and probably doing an amazing job. And so feel good about that, first of all. The second, having said you're all really expert at this, is that you do not need to be a specialist to lead on anything. You need to be a leader. I'm sure all of us know some amazing specialists who are really, really good at being special in a little special cupboard that they've worked really hard to get to for their entire careers. And then if we took them out of that cupboard and put them in charge of a team, that would be a really special recipe for disaster. Okay, so being a specialist does not mean you are going to be a good leader, and I don't believe you need to be a specialist in order to lead around, especially around a particular issue. So let's acknowledge those two things first of all. So what we will look at during this talk is really thinking about three different areas around how to lead on this area. We're going to talk about expectations, we're going to talk about risk, we're going to talk about support, and hopefully that will cover some of the top things that people are really keen to see addressed by me. And if not, I want to hear about it in the comments below and on the awkward questions at the end. So let's kick off with talking about expectations. I think this is really important across all these issues. I'm going to really be thinking, speaking especially to those of you that are leaders and are leading a team, about how you not only manage the expectations of the young people that are in your care and that your staff are supporting, but also the expectations, and for all these areas, how they affect your team themselves. I think the first thing when it comes to expectations is that we really need to be honest with everybody when it comes to children and people's mental health and the system that we are supporting our staff and the system that young people are able to access. We don't have a system that can support the needs that are out there. It does not exist. It's not that it's being done badly, it's just that we don't have it. It's not funded, it's not there. And I think we need to acknowledge that that kind of openly and honestly. Like we have to acknowledge that there are challenges around this area, and we have to be honest, because otherwise people will know. That's not that's information that's not politicized particularly. I mean, it is a political issue, but NHS England is hoping that by 2021, 1 in 3 young people that have a diagnosable mental health illness will be able to access a service for a diagnosable mental health illness. That's not 1 in 3 children and young people, that's 1 in 3 children and young people we know need a service. And I'm sure this is not news to most of you, okay? So what that means, though, is that there are 2/3 of young people that are not, their needs are not going to be met, and there's not even a place for them within a specialist service. And so if you're seeing more children and young people coming into your community teams and coming in and one of their kind of main presenting issues being their mental health, or you're in a hospital and you're seeing more young people come in due to their mental health, like that is the reality. Like that is because there is, really, there's a lack of additional services. Alongside that, we know that we've spent the last 10 or 12 years getting rid of everything in early intervention. And I'm sure that all of you, whether you work in a community epilepsy team or you work in a inpatient surgery team, you're going to be seeing issues more and more presentations that you said, oh, I wouldn't have seen this 10 years ago. We would have intervened earlier in this. This person would have had some public education around this area. They would have had a Sure Start center to go to get some advice early on. We're seeing much more that could have been prevented. And it's absolutely true. The Children's Society last year released a report, and I'll put these links, I'll tweet them out at the end. They released a report that said between 2011 and 2018, half of the money that was spent on early intervention for children and young people was taken out of the system. So that's a huge challenge to us, and it doesn't mean that that it's an impossible challenge, but I think we need to acknowledge that. And nobody expects you as a leader to have the answers on that, to be able to solve it. I have spent most of my career telling children, people, and families, like, hey, actually, I don't have the answer. I'm going to work with them to try and figure out what's possible, but I'm not going to just be able to sort of fix things. That's not the role, and that's not what's possible. And I think once we make it really clear that those are the expectations, and we have a conversation that's really important, and that your staff will benefit from that, and the young people that they'll care for will benefit from that, so that they can get a little bit more context as to why this is happening, rather than just feeling like, oh, well, I'm not getting a service, or you're not choosing to help me because you're just a jerk, as opposed to they're not being something there that's what they really need. So the next area I'm going to touch on, and I'm trying to fly through things here so we can have plenty of time to talk in more detail. It's about risk. I mean, I think, look, any time I go anywhere with a mental health hat on, everyone's like, can you talk about risk? I've got to talk about risk. Very worried about risk. And I'm like, okay, I'll mention the word risk. Look, it's on the slide over there. Doesn't everybody feel much more reassured? Look, when thinking about how to lead on this area around risk, first of all, you've got to do the things that I've already said. You've got to be honest, and you've got to acknowledge the challenges, and acknowledge what's there. I think linked to that, for me, and where this talk got the title from, is needing to talk about the elephant in the room. And the elephant in the room, as far as I'm concerned, is almost always risk. And maybe rather than starting with young people, I'll start with staff. Look, at the moment, our staff, there's always been a lot of risk around our staff and how we support staff, especially staff that are, under a huge amount of pressure, even more so for many, frontline staff at the moment, because of the world and what everyone's experiencing. But really, all of us, whether it's people that are, you're now working remotely from your teams, that stress that you're feeling as a leader, the stress that your team's feeling, because that's such a change in what they're used to. We need to acknowledge that risk exists and is there. Like we have not a great record of kind of supporting our colleagues when it comes to healthcare. There's been a number of studies I'm sure you've seen around, nursing having higher rates of suicide, and we don't often have these conversations with our staff around the risk that they might present to themselves, or the stress that they might be under, and how that affects their mental health. And if we're not going to have those conversations with each other, it's usually even more tricky to then have them with young people. So I guess we need to acknowledge it with both. Risk exists whether we ask about it or not. So, I would say that the way to lead on this area is to talk about risk, is to acknowledge risk, is to be direct about it, is to ask direct questions about risk. That's going to show everybody that it's okay to have these conversations. And if it's okay to have them, you as a manager to them as a member of your team, then you're going to mirror that when you're saying, hey, I also want you having these conversations with your patients, with the children and young people that you're seeing. A lot of people are worried, well, if I ask a question about risk, there will be more risk. I'll know about it. Like, what is more risky? The risk that we know about, or the risk that we think might be there, but we haven't asked about it? Like, I always think, it is much easier and much safer to have risk that we're like, we know about this risk now. We've got no idea what to do with it, but we know about it. Actually, that can be tackled. The risk that is unknown, the risk that we've never asked about, that just sits there, and we don't know if that's going to come out in a extremely worrying way, or it's just going to fade away. Risk goes up and down, but we need to ask about it. We need to acknowledge it, especially again if it has become the elephant in the room issue. The number of young people I've spoken to that talked about how they might be in different settings, whether it's in hospital, in the community, with their diabetic nurse or with their GP, that have said, well, I think it's really clear that I'm not all right. And they're asking, lots of woolly questions, and I can kind of tell that they're worried about me. And I know what they're thinking, I know why I'm there, and I know why they know that. And we're both thinking the same thing, and it's just incredibly awkward, and nobody's acknowledging that actually maybe that person doesn't feel safe. Maybe that person feels like they do want to die. Maybe that person is worried that if they leave being with you or being with your team, that they'll go home and harm themselves. So acknowledge that, it's a difficult thing to have to think about how you address, but it's really important that we do. And when we do that, let's ask direct questions. It is okay to ask someone a direct question, like, did they want to die? Did they want to kill themselves? Do you have thoughts now of wanting to kill yourself? When I say them, I don't think they sound that awful. When you write them down and say, ask these things, I think they often sound really sort of violent and scary. So maybe try asking them, beforehand, or don't just read them out, because I think that can make things look really difficult. But ask them, if you're worried that somebody is going to hurt themselves, you've kind of got a sense or something they've said that you've picked up on, ask them, whether that's a patient or whether that's a member of staff. I think we need to ask those questions if we're worried about people, to all the people that we look after. And as I say, I think especially if we're concerned for the welfare of our team members and their stress, it's a question I talk with my team about. It's a question they will talk with me about. I think that's really important to acknowledge that. So yeah, it doesn't cause harm. In fact, it's probably going to help. So please ask direct questions. And there's some really interesting studies, and I'll share some links to, that look exactly at that effect. Because I think especially when it comes to asking about suicide and risk of suicide, that people are like, oh, you can't ask that, because then we'll give them the idea. And this is something that's especially true, I found, in hospitals, which for me is kind of really interesting, because I'm like, well, literally the thing that people know about hospitals is that when you go into a hospital, you usually like come out alive or you die, like that's the kind of thing, like a hospital is a place where there is life and death happens, but yet staff that are there are like, well, we can't ask about suicide because might give them the idea, and it's like, well, they're probably aware of death in general, and it's probably on their mind as they're sitting in a hospital or engaging with a health service. So please ask directly. I'll stop being on the bandwagon about that. So the final kind of area I want to touch on is around support. This for me is a really critical one at the moment. Not only support for children and young people that I think we can acknowledge is lacking in a lot of areas, but really as well thinking about how tough it is for staff. And I really, empathize, especially with staff feeling like they are having to tackle and deal with issues that they're not used to, they've not had any training on. Look, the topics that I have found throughout my career are the most difficult to deal with are the ones that I've known the least about, and that, I think that's the way it is for everybody, really. And I think that's okay to acknowledge that that's how it feels. So when it comes to thinking about the support that we can provide, both for our teams and for young people, again, we have to start with all the things that we've already covered so far. We have to start with being honest, to start with acknowledging the challenges, especially if that support that exists isn't up to par, or that there's only limits to what we can do. I mean, to acknowledge any elephant in the room questions or issues, and we need to ask direct questions around the support that's there. So when it comes to support, there's some additional things that I'd like to suggest that we all do. First of all is validate. So, validating someone's experience, like providing them with some positive reinforcement that, you're glad that they've shared this concern, especially if it's a staff member, you're glad they've shared, like, if they're struggling with how they're doing, like, validate that. Like, I'm really pleased, if they're struggling to look after patients and around their mental health and they're letting you know that, validate, be really glad that they've told you that, because actually we've got a lot of data that says most, certainly most hospital staff really struggle with providing care in this area. So one, be glad they've done that. In the same way that if a young person was disclosing details about their mental health or struggles with their mental health, or perhaps some things that are really concerning to you, please validate, encourage your staff to validate that they've chosen to share that with you. Like, that is a good thing, that they, that you're clearly somebody that they felt confident to share that with, even if you're kind of like, oh, I wish you'd given that to somebody else that could have helped you more. It's probably a huge help that you were there to listen at that time and that they felt comfortable to share that with you. letting them, validating their experience, kind of acknowledging that, yeah, like, sounds like things are really difficult at the moment, like the things are really tough. I think that especially around validating not only young people that we're supporting, but around our team, things are really difficult at the moment. I think for anybody, that's having to balance, whether it's having to balance work and family and just life, and all of our anxieties and worries about what's going on in the outside world, outside of our kind of clinic, or offices or rooms. There's a huge amount there. Like, and if we're feeling tired and exhausted and more vulnerable than we would normally be, let's kind of validate that experience. That is that is the reality, I think. And so having that conversation, especially as a leader, I think is really important to let your staff know, because again, that needs to be echoed with the young people that they might be supporting. And rather than thinking about the ideas that to generate, a lot of people say, well, what support should we be providing, or directing young people towards, or even what should we be providing for our staff to help them? Like, you've got the word mental in your job title, Robin. Like, what are the top things for good mental health? And I would say, look, it really varies on the person and often on the individual, and really the only way to figure these things out is to ask people, and I would really think, asking people what they need right now, like whether that's a young person that's in a kind of midst of a crisis, asking them what they need from you, as the individual that they're seeing. In the same way, if you're worried about your team and how they're doing and their mental well-being, have a conversation with them. Think what would be helpful. Don't just automatically jump to thinking, if we put on Zoom yoga on Tuesdays at 4 o'clock, that is exactly what our team needs. They'll love it. I mean, maybe that is what your team is going to tell you. I would love it. My team told me that that's what they wanted. I don't think that they will. I feel like my team is more likely to be like, can we like do some sort of pub quiz and have some pizza? And that might be what they need. But whether you're asking staff or you're asking young people, like, have a think with them, have that be part of a conversation. If you're seeing a young person that's in crisis, ask them what might help right now. Have they been in that experience before? What do they find useful then? Don't just think, oh, what we need is a worksheet that says, like, here are the top 5 like really brilliantly useless apps for making myself feel a bit less crap. Like, okay, I mean, I'm sure they have Google and they could have found those. They just don't have a printer. And I don't think that like the expertise that you're going to bring with having the printer is going to, kind of like be the thing that really makes the difference. I don't know. I mean, I still think people that have got printers are like properly professional and grown up, but that could just be me. So, some other ideas for thinking about what you could do with staff that are not in the kind of more wellness area. You could, I really enjoyed the places that I've worked that have formed links between teams. So especially if you're working in a community team in a certain specialism, so thinking about, well, how can we link that up with other community teams? And perhaps, can we have a reflective group that meets once a month or once every couple of months that just talks about some of the, children and young people's mental health related issues that we're seeing, and how we handle that and how that's going. That can like recommend like education that people might have come across, because there is some good stuff out there. And so, thinking about how you share that, or whether it's just having kind of reflective groups within your teams to not just talk about like the terrible incident that happened the other week. We're really good, well, no, we're not always really good, to be honest, but we are better at having groups when there's a thing that happens, rather than reflective groups or debriefs when just thinking about the normal kind of ups and downs of being in our job roles. So I would encourage those to be set up more regularly and for you to have those, because I find them really valuable. And I, trying to kind of have a space, whether it's a group space or an individual space, to talk about the impact that, that these issues have on us. So yeah, I'd really encourage you to do that. My favorite one that I did in the past was that we used to have a community diabetes coffee morning with biscuits. I know a number of things about that sound really wrong, but it was actually brilliant. but when we just, it was a kind of coffee and consultation where sometimes we would talk about young people, but sometimes we would, really just talk about sort of general issues and topics around this, as just a helpful way to kind of have that dialogue. So yeah, so please, I encourage you to come up with your own ideas. If you've got ideas as well that are particularly brilliant, or that you found have really worked for your team, I'd love to hear about them and then share them. So yeah, please tweet them in or put them in the comments below, so we can share them with people, because I think often we're good at keeping good ideas to ourselves, or not having a way to get them out wider. So please do. So across all these areas, if you want to lead on mental health, regardless of your job role or the letters after your name, if you're able to address the expectations of your staff and of young people, if you acknowledge the risk and the elephant in the room, asking direct questions, and if you support your team that work for you and support the young people that are in your care, even recognizing that you might not have all the answers, you absolutely can lead in this mental health system that in itself is often seen as being in crisis, and you're a part of making that better, and a really valuable part about that. So please don't underestimate the impact that you're already having, and that you will continue to have. And if these things that I've sort of suggested, and these areas that I said, look, concentrate and do more of this, if you're saying, hey, Robin, that was great, I'm already doing that, brilliant, just please do more of it. Because for me, this is the core way to really impact change. And if you're leading in this area, I'm really glad it's you. And I'm really pleased to have spent this time with you. So I'm going to wrap up the kind of webinar part of the talk. I've mentioned some training at the beginning, and I'd love to touch on that. We Can Talk, the project I work for, I got some funding to develop some online training. It's 1 hour. It takes up maybe around an hour. If you go back and forth to it in chunks, it takes around an hour. If you do it in one sort of binge, it's probably around 40-45 minutes. And it is aimed at any person that's working in health, across any level. But it's kind of specifically thought about for staff that are working in hospitals. But if you're working in a community team, I think equally enjoy it. It's really thinking about what are the kind of key areas to think about. How do we provide compassionate care to young people in mental health crisis? And I think it's really linked to this topic, especially when we're not a specialist. And it's designed for, if you're a porter or you're a pediatrician, this is accessible. So it's co-designed. So we had our young advisors, who are young people with experience of presenting to hospital in crisis. They wrote all the content with us. They work as part of our team, and they delivered all the content. I was actually written out of the script for this online training at one point in its development, which I think is better for everybody. So you don't have to see my face again on that online tool that is entirely presented by young people with lived experience. It takes less than an hour. Your progress is saved. You can do it on your phone. You get a certificate, and it's totally free. So we've had more than 3,000 people sign up to do it in 2 months since we launched it, which is amazing considering how busy everybody is. So I would really encourage you to share that with your team members. Check it out yourself first. Like, if you don't think it's any good, it's fine. People that get through it, I think at the moment, 99.6% of people, there are like 6 people of the people that have completed it that said they wouldn't recommend it. So we're going to find those 6. And we're going to find out exactly what their problem is. No, we're not going to find you. Starting to sound mildly threatening. So this is the problem of talking to yourself too much without any level of feedback. So speaking of feedback, we're going to move into the awkward question Q&A. I'm going to fire up Twitter to see if we've had any interaction on Twitter. And I'm assured one of the I don't have their name in front of me now, but the CAMHS all of them, all of the other words after there, is going to text me some of the questions that we have received, if we've received any in the YouTube comments. Otherwise, we're going to go to the questions that we've already captured as a part of the exercise before this webinar started. So it looks like people are less active. In my mind, it's because you've all kind of got a cup of coffee, which I will now refresh with. You've all got a cup of coffee, or possibly even a sandwich, and you're attempting to take a lunch break while also learning, which, to be honest, is probably the only way that any of us ever get lunch breaks. It's like, I'm learning and I've got a lunch break. So please don't mess the keyboard up by also trying to type in questions at this time if you're also eating lunch. So let's go to some of the questions that we had in already. We've picked the most awkward of them, and I'm looking forward to seeing some of these. Right, okay, so can't we solve this problem with more CAMHS beds? Oh, that's a brilliant, I mean, I'm glad we picked that question out. I think we get a bit obsessed with beds when it comes to CAMHS, as if beds will solve all of our problems, or that's the reason why that's the kind of where the crisis point is. My reaction around when people want to talk about beds, it is to kind of ask a bit of a sort of parallel question, is that if we had an issue in the community that actually we were seeing more and more young people coming into hospital or presenting to primary care with broken legs, if we had this sudden influx, we had this sort of crisis, this pandemic of broken legs, and we just thought there's just more and more people coming in with broken legs. I don't think our first response would be, you know what we need? We need more places to put these people with broken legs. We don't need to create more bed places for broken leggers. That's the technical term. That would not be our reaction. Actually, we would go, well, let's look at what's creating this situation. We go and look and we go, oh goodness, we've let the pavements get into complete disarray over the last 5. We need to fix the pavements. We're creating a public health crisis because we've not been paying attention to the basics around our infrastructure. Look, I would say that the same thing has been happening around mental health. Actually, we don't need more beds. We need to fix the pavements. We know that actually, 75% of lifetime mental illness is identified before people are 25, excluding dementia. So, that almost all of what become chronic mental health problems in adults are identified before the age of 25. But yet, as I kind of mentioned earlier, we've also taken out half the money in early intervention services over the last 10 years. If we take out, and I think all of us would have seen that in our own communities over the years, is the stuff that I would say, the stuff that was keeping young people and families well, the sort of the places for adult education, for carers and parents, youth clubs for young people, activities that young people can access, after school programs, children's centers. Everything has been cut back and back and back. All those things, from my point of view, they had a huge part in holding and maintaining and diverting people away from, needing to get to a crisis point, kind of managing stuff, intervening early. We take away all that stuff that's holding people and keeping people well. And then I don't think our reaction to when things increase should be, oh, well, what we need is more places to put them. It's like, no, we need to address this, at the root. So I don't think we solve this problem with more beds at all. In fact, I think that's the wrong direction for us to go in, personally. And let's go to the next question. So don't young people simply need somewhere else to go in a crisis? This is a question I've heard a number of times from hospital colleagues that are, I would say, often frustrated that they are seeing more and more young people in acute hospitals, as I heard quite kind of unhelpfully, just whether it's bed blocking, taking up space, can't we just have somewhere else to put them? And look, there's been a lot of positive change that's happened, especially recently, in terms of increasing the provision for crisis care lines, so that people have got a telephone number that they can call for some crisis mental health support, and extending that down to all ages gradually in different areas. The same around thinking that absolutely there should be alternative places to go to for people in a mental health crisis. And however, there are always going to be children and young people, and I speak this especially to kind of hospital colleagues, there are always going to be children and young people that will need to come appropriately into a hospital due to their mental health, or that I believe hospital is the safest place for them to be managed. Young people that might have additional sort of physical needs alongside their mental health needs at those moments, whether it's due to self-harm or overdose, psychosis, where we're kind of unsure if there's an organic reason behind that psychosis, or or drugs or other substances, or young people with eating disorders, where again that overlap between physical health and mental health is really strong. I'm not in the camp that thinks that we can separate out physical and mental health pathways. I know that's a more popular opinion among certain people. I don't agree with it. I don't know how you separate those out. I also think that we also haven't done enough to think about how young people might receive this. In terms of, if we're saying, well, actually now a mental health crisis is not quite crisis enough for you to go to a hospital, even though we've trained the whole general public that hospitals are for emergencies. Your emergency is not quite emergency enough, so you have to go here, especially if that here is like somewhere that looks like a sort of a random community building, like after dark, then you're seeing somebody in like a glorified broom closet. Like, it's quite a different experience from kind of even the sort of the response and the sort of containment that can come from being in a hospital setting. So I think other people need ways to access mental health support, absolutely. But I think that we need to think really careful and in consultation with young people about the places that young people and how we need to set up crisis provision for young people. And I don't hear enough of those voices for me personally. Again, other opinions are available. Please you assess them as I have done. Next question. Sorry, I did load these in, but I barely looked at them because there's just a kind of a batch of them, and this one's kind of great. Isn't most of this attention-seeking behavior? Wow, that's really good. Slash terrible. I mean, when I say really good, I'm like really like on message for the awkward, difficult, or like not particularly PC things to ask. So I'm loving this. Isn't this just attention-seeking behavior? No. I think, look, I mean, could it be about seeking attention? Could it be about seeking care? Absolutely. I think that, we unfortunately, and I've spoken to too many young people about this, but we have, unfortunately, because we don't have services that can meet all the needs of everybody, we have, whether we admit it or not, very clearly set sort of thresholds and criterias for people to get into, especially into specialist mental health services. And that means that does not get lost on children and young people. And so there are certainly children and young people that are escalating their behavior because they want to get help. I've had conversations with young people that I've seen in hospital about this, where I've talked to them about like the danger they've put themselves in or the damage they've done to your body. And they were like, look, when I went to speak to X, Y, or Z person before this, whether it was in a school, whether it's in primary care, whether it's in a youth center, they were like, yeah, I know you're feeling really bad, but we can't get you any help. And it's often, we can't get any help, because you're not a danger to yourself, or you're not hurting yourself. We give people the message that the only way to get help is to escalate the behavior. And if they really feel they need help, they might escalate that behavior. as adults, we have ways of seeking attention. If I want your attention, I'll sort of, hey, I need, help over here. Like, if I'm struggling with my mental health, I'll pick up the phone, I'll speak to my brother, I'll speak to, one of my colleagues, and have that conversation. Say, look, I'm struggling at the moment. Like, I need some extra help, or I need some extra support, whether it's at work or at home. If somebody doesn't have that language yet, or doesn't have those roots available in their life, and they're looking to try and seek that attention in other ways, like, they're going to look around and see what people respond to. And we, unfortunately, especially as a health system, we respond to risk. And I think it kind of links actually to that earlier question around, if we make it so that young people, there's even more barriers to perhaps young people being able to go into an emergency department, go into a hospital. That's only for the young people that have kind of got, really serious sort of physical issues alongside that. If we make it that's the case as well, I worry that we'll see an escalation in that behavior as well, because people will say, well, look, I need that. I need to be in a hospital. I need to be looked after in that way. I'm really worried about myself. I really need that level of support. So I think we have to think really carefully about all these changes as well. And I would, as I say, I would flip that round, rather than about saying it's this attention-seeking behavior, is this about seeking attention? Is this around seeking support? Is this around seeking care? And it might be, and it might be that they're seeking care from us as health professionals, or they're seeking care from, others, whether that's parents or carers or their peers, and I think that doesn't make it any less valid. So thanks for that question. That's a really good one. And I'm going to do the next one, which I think is the last one I have on there. So if you do have, I think so. If you do have other questions, please put them, I think the correct thing to say is please put them in the chat, but I can't see the chat. So I'm then hoping that I'm going to get text any questions, because I think this is the system that we came up with. So yeah, the last question that I've got from the ones that were submitted in advance were, again, a brilliant one that relates to risk. How can we make our rooms safer? Again, this is a classic question that I get, especially when thinking about children and young people, and that people are very concerned that, like, oh, well, we've got to, we put them in a room, and then somebody comes in, kind of sneaks in the room, sort of smiling very kind of awkwardly, then picks up the sharps box, and then sort of backs out the door, and it's like, okay, cool, we've got them safe. Like I've had lots of conversations with young people that have, felt at different times when they were in various settings, whether that was in the community or in hospital settings, that have felt like they were a danger to themselves or to others in those moments. And the thing is we're not going to be able to make those rooms safe by just removing things or having them set up in a really safe way. I spent 3 months as a student working in the most secure kind of place. There's sort of 7 very secure units that they keep children and young people, in the UK, and I spent 3 months in one of them. And even in the most secure places that are the most safe and the most sterile, it's a brand new unit, even in those, young people were still able to harm themselves quite significantly there. And that for me is because risk is not about the room. Managing risk is about the relationship with the person that's in the room, and having those conversations. For every young person that actually they might find that helpful for you to take some of the things out of the room that are an obvious danger to them. They will not find that helpful if you don't do that without a conversation, or you will not know if it's helpful. Because I've met young people that were like, actually, the moment that you started taking things out, the moment the staff started removing things from the room, I started thinking about all the different things that they hadn't taken out that I could use to hurt myself. Versus before then, I wasn't feeling particularly worried about myself and that room. So risk is about a relationship, and we have to have those conversations. Have those direct conversations if you are worried about that risk, and make that judgment with that young person. That's not to say that everyone's going to be able in those moments to give you a really sort of clear or even honest answer. I've had lots of conversations with young people where I'm not sure if they're able in those moments to actually be able to be completely open and honest with me, partly often because they have just met me and I'm asking them all sorts of really difficult, challenging, awkward and direct questions. So I can totally understand that. I mean, one of the questions I really like to tag onto a lot of those assessments and those when I'm asking is, can I just check, like, if you would you be able to answer that question? Like, would you be able to tell me if you did want to do this or you did feel this way? And sometimes that allows them to be like, no, no, I wouldn't, you know. And it's like, cool, fair enough. Like, you know, if I was feeling really distressed, especially if I, you know, was also experiencing perhaps other, you know, symptoms, whether it's paranoia or, you know, intrusive thoughts, you know, that might be quite difficult for me to be open and honest with anybody, however well-meaning. So I think don't put it down to that being something to do with you. But again, on this conversation around like safety, conversations and questions, or how you are going to be how you keep people safe, not thinking about like it's not saying don't think about it, but that will not just removing things doesn't just remove risk. So please don't get into that idea, don't get that assumption that that's the way to do things. So awesome. I'm going to check the Twitter one more time because I think, yeah, that was the last question. And so please stay in touch if we don't have any more questions. I'm not going to drone on with other further radical thoughts. You can view all of those online through various means. I'm going to check the Twitter and see if we've had any more. I'm hoping, again, this is because you've all decided to take the right decision and engage in a bit of self-care in terms of having lunch. So nothing that has changed from the ones that we've asked. So I'm going to say thank you so much. Thank you very much to the Pan-TEMS Pediatric Wellbeing Hub Network, in all those words, in possibly that order, but certainly thank you to all the team there and for the invitation to come and speak. And who knows, we might get an opportunity to talk on some different topics going forward. That would be great. So if you've enjoyed this, I don't know if it lets you like the video, but please like the video, subscribe to their YouTube channel because they've got like thousands of subscribers, but you could be the next one. So please subscribe to their YouTube channel. And yeah, drop any additional thoughts and ideas and feedback. All the nice things you can tweet, all the things that you didn't like, just send me an email and we can just work it out offline. No, all messages gratefully received through all media. And I hope that this afternoon's, this lunchtime's chat has been able to give you some ideas to take away, to share with your team. I've certainly enjoyed the experience of talking with you, and look forward to hopefully engaging with you outside of this live webinar format. And thanks very much. Have a good rest of your day, and yeah, keep doing all the amazing work you're doing. Cheers.